There's a number of studies that have been performed that show dramatic improvement with Nandrolone. So let's talk about this one. This is a study that was done at a University of North Carolina, Chapel Hill, and this is where an orthopedic surgeon focused on managing issues with rotator cuff injuries, tendon injuries, shoulder, and also the reverse part of the shoulder. So when you do a normal rotator cuff surgery, you go in and reattach this. But what they're actually talking about is switching it even the opposite direction. And that has tremendous benefits if people have to require that particular procedure. Now, what happens is utilizing the Nandrolone in conjunction with testosterone, there's an improvement in the recovery. They feel better quicker. They show marked reduction in inflammation. And these individuals will return back quicker than individuals that were not that extensive surgical procedures that were required. Some, in fact, this reverse total shoulder replacement. So it's the whole switching around. Dr. Spiro Karas, who is an assistant professor of surgery and an orthopedic surgeon, and examined the benefits of Nandrolone in studies undergoing recurrent shoulder pain, recurrent shoulder injuries, and post-surgical procedures with a number of men and women. And this average age was about 52 years of age, but it had men and women. This also demonstrated increased improvement or with individuals who had no Nandrolone and showed exercise, and the individuals that had no recovery and how prolonged that was. So this study was comparing these specific groups and how the benefits of using Nandrolone and how Nandrolone was improved. This study looked at about 4 days after these surgical procedures were done. What it did is show the utility and the use of Nandrolone in conjunction with exercise groups, showing a marked improvement and much greater decrease in inflammation when compared to other groups without Nandrolone. This study was very impressive. What it showed that in about 4 days after these surgical procedures were performed, the individuals who utilized Nandrolone in conjunction with exercise showed a marked improvement and a much greater decrease in inflammation when comparing to other groups without Nandrolone. This study showed that about 4 days after the surgical procedure was performed, utilizing Nandrolone in conjunction with exercise groups showed that a marked improvement was found in the joints and recovery, and a much greater decrease in inflammation when compared to other groups that were not utilizing Nandrolone. So there's a significant benefit to utilizing the Nandrolone in this group of individuals having major surgery.